Okay.
Okay, so this is the call center volunteer training. We set up a call center right when the pandemic hit to help us take calls because we were getting a lot of calls for help for food. So it's something that we have definitely revamped and have definite need for volunteers to help us with. So our call center is volunteer ran. The call center hours are between 9 a.m. to 12 p.m. on weekdays. There's a Webex app that forwards calls to your phones, which Lacey will go over in some slides later. And then all volunteers must sign a non-disclosure agreement, meaning that you're not going to go talk about who you've talked to. It's all private and kept confidential. So our shift schedules, like I said, run Monday through Friday, 9 a.m. to 12 p.m. We can make some exceptions for afternoon if needed, so keep that in note. And the daily task would be to field incoming calls using the Webex app, monitor our email that we have for voicemails left after hours, and then return missed calls and voicemails. So the programs and relevant organizations that you guys will be getting calls about are going to be our older adult nutrition program, which was previously called Brown Bag, our Safe Net food distributions, which are all the sites we started during the pandemic to get more food out there to the community. You'll get calls from Care for about pet food, and that's Care for Paws, prepared meals, which we'll forward to Meals on Wheels. And then we are going to start getting calls regarding CalFresh and the PEBT benefits.
Thanks for the introduction, Kelly. Are there any initial questions for Kelly before we get a little deeper and technical? Any intro questions?
Are you seeing me? This is Lamberto Leva.
Not seeing you, but we can hear you.
Okay, all right. That's probably just as good.
Great. Anything else?
No, I'm following along. Yeah.
Wonderful. Okay, any questions from anyone else before we dive in? Awesome. Okay, I'm Lacey Valdivias. I'm the Director of Community Programs and Education with the Food Bank. And so probably the main program you're going to get questions about is our older adult nutrition program, like Kelly mentioned. And this was previously called Brown Bag, in case you are familiar with that, but it doesn't translate very well into Spanish, which is a focus of ours now. And so this is much more translatable, if you will. So just an overview of the program. It is now pretty much fully home delivery, and the home deliveries are made by volunteers, which Kelly helps us to coordinate. It serves those who are 60 years and older, and those who are 55 to 59 with a disability can also qualify. It is a federally funded program by the USDA, so we do have to comply with some of their regulations. So you may receive some questions about the income thresholds, and we provide that in the information for you, so you'll know what the income thresholds are. And then we also cannot discriminate based on anything, gender, sex, ethnicity, language, anything like that. So just keep that in mind. Folks who are in the program receive twice per month deliveries, and they occur on an ongoing basis. So they're just regular. Once they're in the program, they're just regularly on our schedule. So how will you receive calls about this program? The way that it works is we have this application called Webex. It's by a company called Cisco. And I put the logo on there to help you identify it. But basically, once you are logged in, you log in using our email and our password, which are written here, and we'll provide that to you in a follow-up email. But whoever's logged into the app will receive the calls from this number. So you'll receive those calls on your cell phone, and then you just want to be sure to log out after your shift, so then the next person can log in and receive the calls on their phone. Are there any questions on that before I move on? I think the only tricky part here will be just making sure you get the right app on your phone, but otherwise it's pretty simple to log in and log out. So what kind of calls or questions might you receive? People often ask, how do they apply? So we'll cover that, show you the application, and if they qualify. So that would be the age and income that I mentioned earlier. So I'll walk you through that. Some may ask, what is the status of their application? And one thing to note is our program does require a medical authorization. So it could be a doctor, it could be a nurse, it could actually be a social worker. Any kind of professional who is assisting the client would need to sign off that they actually do have a need, that they can't reach the program themselves, or they don't have support people around them who could pick up a food box for them. So then we would go that extra mile and provide the home delivery. So oftentimes when they're asking about the status of their application, your question would just be, well, have you submitted your doctor's note with it? And if they haven't, then the status is just going to be pending until they have that authorization. You may receive some more specific questions about their food delivery. So numbers 4, 5, and 6 would be things that would be unique to the individual. And for that, excuse me, we're going to have you download another app to your phone where you can directly communicate with our team in real time. So it's called Slack, and I'll show you that. I think that might be on the next slide. But they may ask when their delivery is coming, which we can look up for you. If they had any issues with the delivery, like they didn't like the food provided or the food was spoiled or something, we may need to send sort of an emergency delivery out if the food was spoiled, for example. So you would just pop that into the chat for our team, and then we would set that up and let you know when we can get a delivery out to them. They may also ask for other services, which is what Kelly referred to in the introduction, where assistance with pet food or assistance with prepared meals, which are beyond the scope of the food bank. Any questions on that stuff? Okay. So first, when they would like to apply, these are the qualifications. So their age range, at least 60 years of age. The income, there are 2 income eligibilities. If they're a single person, there's a certain amount. And if they're a partnered person, then there's another amount to provide to them. And then they also, as I mentioned, have to have an inability to seek the food on their own. So there's that medical authorization required as well. If they would like to proceed with the application and they have access to email, that's the quickest and easy way, is to just collect their email and send them the application by email. If not, if they need it mailed to them, then we have a request form, and that link will be on the information we provide you. And so you would just fill out the request form giving us their name and address, and we will mail them the application to their home. If the person is ineligible, like maybe they're not old enough or their income is above the requirements, then you just can direct them to one of our SafeNet sites. So those are food distributions that are open to everyone in the community, and they can just attend that, or they can have a family member, a friend, a neighbor attend and pick up the box on their behalf. So this is just a quick look at the older adult nutrition application form. I've kind of mentioned all of this already, so I won't go through it again, but kind of any authorized professional can vouch for them, if you will, and say that they do need the additional support of home delivery. And then if a person does not have access to a physician, we can always direct them to a local community health center, which provides services for lower income individuals. So they may be able to go there and have a professional sign off on their application at one of those locations. So we'll also provide you the list of resources. So depending on what area of the county they're in, you can refer them to their local CHC. So next, I mentioned that you may have some questions where you will need to speak with our staff in real time. That's if that's something really specific, like they're missing their delivery, or they don't know when it's coming again and they need food. So in that case, we will have all of you download this app called Slack. It's just a chatting and messaging application that lives on your phone. And we will have a feed called #call center. And so you'll have access to that. I'll grant you access to that, and you would just post your question in there. So an example would be, when is client A's next delivery? Or a client B was expecting his delivery yesterday. Was it on the delivery route? And then my team will have a schedule for monitoring that Slack channel for you. And whoever's on call that day would look up the information and respond to you. So you can feel free to put the individual on hold or collect their callback number. And so once you receive the response, call them back with the information. And then during COVID, we had offered an emergency food delivery request, which was open to anyone who called in. They could get a one-time emergency delivery. We're no longer offering that. So if people call in asking for an emergency delivery, we would refer them either to the SafeNet sites. If they need it really immediately, they need to get food, they could go to one of our distributions. Or if they are qualified, then they could apply for the older adult nutrition program. And you would just follow the same steps that I outlined before for that. Before I hand it over to Kelly, are there any clarification questions that should be addressed right now? Good, sounds like there aren't any, but we will provide all of this in a written format for you as well in a follow-up email. So you have all the links you need, you have the step-by-step. So this is just kind of walking you through it first. And then Kelly, I'll hand it over to you.
I do have one. Can you hear me? Do they have to email you to get, once they get the Slack channel, so you can grant them permission, or does it pop up on your end?
I think the best way is once they sign up for a shift with you, Kelly, if you just give me their email, then I can grant them the access.
Okay. All right, so like I mentioned earlier, you guys might get some calls for pet food. We redirect those calls to another organization called Care for Paws. They can further assist them with that request. We'll also send this information after the training. And then for prepared meals, we'll get those requests as well, and those will be directed to Meals on Wheels, which I've listed Santa Maria, Lompoc, and Santa Barbara. So you'll have that information as well. So if you have anybody that becomes rude, disrespectful, or makes you feel uncomfortable in any way, you can refer them to Jacqueline Valencia, who's the Assistant Director of Programs and Education, and she will handle that situation for you. So the support materials you will receive, you're going to receive a call script in English and Spanish, a list of CHC locations, a list of SafeNet distribution locations, the mail-in application request, the fact sheet for CalFresh and PEBT, the Webex instructions, and the Slack instructions. You'll get the North County older adult nutrition application, as well as the South County. So the next steps would be, if this is something that you think you're interested in still, I ask you just to write your name in the chat real quick so that I can follow up with you in email. I will email you after this and send you all the information you need, and we can go ahead and and also email me your shift availability. What days, what time, or what days work best for you if you need a different time, and that way we can try to figure out where to fit you in. And then the contacts right now for North and Mid County would be Lacey, and then the South County one would be Noemi Hernandez. And then I think we're going to hand it over to Daisy now, just to discuss a little bit about the CalFresh and PEBT benefits, as it's going to be new to the call center.
All right, thank you, Kelly. So I'll be talking about PVT. So right now, it's a program called PVT 2.0, and it stands for Pandemic Electronic Benefits Transfer. And it's a nutrition benefit to replace meals that kids didn't receive during the school year due to the pandemic. And what it is there's two different, it's broken down in two different ways. For young children aged 0 to 5, who also got CalFresh between October 2020 and August 2021. And school-age children who were eligible for free and reduced lunch during the school year 2020 and 2021 will be receiving PVT 2.0. So how do families receive PVT 2.0? There is no application like the first round of benefits for PVT 1.0, there was an application, but now for PVT 2.0, there is no application. That benefits are automatically given. Families will receive a PVT 2.0 card in the mail for each eligible child. So if they have 3 children that attend school and their school receives free and reduced lunch, they will most likely receive 3 individual cards for their children. The PVT card will be mailed to the address that the school has on file, or if they are on CalFresh benefits, they'll be mailed to the address that's on file for their CalFresh case. And right now, the cards are being mailed based on the child's age and first name. So for example, a child named Anna might receive their card a lot earlier than a child named Yesenia. Who gets PVT for young kids? PVT for young kids between October 2020 and August 2021, they must have been between ages 0 to 6 and be living in a county where at least one school had limited in-person classes, which in our county, they all qualify if they're 0 to 6 and are eligible for CalFresh during those months, October and August. How much do young kids get? So in terms of the money benefit, they get $123 each month if they received CalFresh and their county had at least one school that no in-person classes. $68 each month if they received CalFresh and their county had at least one school that had hybrid in-person classes. $0 each month if they received CalFresh and every school in their county had all in-person classes, and 0 per month if they did not receive CalFresh. So that is the breakdown in terms of the money benefit that you can explain to people if they ask how much money they'll be receiving for their PVT card. So PVT for school-age kids, again, they have to have been attending school during the 2020-2021 school year, which ended for some students in May, others in June, previously this year. So that's the school year we're talking about. They have to have been enrolled at a school that participated in the National School Lunch Program or School Breakfast Program. Their school was remote during at least part of the school year, and they met one of the eligibility criteria during the 2020-2021 school year. So I believe most schools in our county qualify for school-age kids. I think there's probably like 5 and they're private schools. So if you receive any calls from those types of parents, you can verify with me what schools those are in case they ask. Students who graduated high school at the end of the school year for 2020-2021 will be receiving PVT 2.0 as long as they met the eligibility criteria. But they will not be receiving summer PVT because they would no longer be a student So because they were still a student in the previous school year, they'll be receiving the benefits for the last school year. And so again, how much do school kids get? They, it depends on the school's learning model. Again, $123 for each month that most students attended virtually, $68 a month for in-person and virtually, and $0 for each month that students attended in person. And in most, I think in our county, if students were going back in person, it was a combination of both. At least to my knowledge, there hasn't been any schools that were completely in person for months. Most students will be receiving anywhere between $123 each month and $68 each month. And it can be a combination of both. So people do need to set up a PIN number for their PVT card. So it works just like a debit card. They'll get instructions on how to set up their PIN in the mail, but if they, for some reason, lost that letter or don't know what number to call, you can let them know that they can dial the 877 number that is the state PVT helpline. And they can, they would have to select their language, and there's lots of different languages that they can select on there. So they would just have to listen for their language if they want something more specific. And they would need to have their card on hand because they do need to enter that into the phone and then press pound. And then after that, they would press number 4 and enter their child's date of birth. In order for them to activate their card, they'll enter their zip code and then enter the 4 digits that they want for their PIN number. So that's how they would have to set that up. You can let them know this is how you set it up. And if they still have issues with it, because maybe the date of birth isn't working, they can always call the state helpline in order to change that address, because that has happened. Just because the school might have the wrong date of birth on file or whatever the case may be. But those issues can be fixed. How to use the PVT card. They can use the card to shop for food at grocery stores, farmers markets, and online stores that accept EBT cards. They can, again, use it just like a debit card. They would just have to select EBT at checkout and enter their PIN. Multiple cards can be used to pay for one purchase. So if they have multiple PVT cards, they can use multiple PVT cards. We do want everyone to keep the PVT cards because more benefits will be added in the future. So that is, I think, the most important key thing about PVT is just to let everybody know to keep their cards because they will be getting more benefits throughout the end of this year. And the benefits do expire after 1 year. So they expire starting the day that they use their card. So it's not the day that they receive it, but the day they start using their card. So the first time they swipe their card and spent benefits, that's the date of their expiration. But most people use their cards before that date. But in case people ask if they expire, they do, but they have a year. Okay. Sorry, there we go. So helping families. So with your new knowledge of PVT 2.0, we can help families answer questions that are receiving PVT 2.0. We can help them, let them know what it is if they don't know yet. They some of them might be wondering why they're receiving it, so you can explain why. And again, it's a federal program that started during the pandemic for children that missed out on meals during the school year because of the pandemic and all the schools were closed. So that's why that program exists and why they're receiving a card. You can now help them with what they can buy, how to set up a PIN number, how to use the card, and then estimate when a card might arrive based on the child's name. Again, let them know to keep the card because it will be reloaded. And then when it will be reloaded, and then that the card expires if it's not used in a year. I will add one more thing to the list of things that Kelly will send, and it's just a small cheat sheet to let you know, when new benefits will be reloaded onto people's cards and when they'll be receiving what. So that way it's less confusing. So I got you guys. And then again, if there is a question that you come across about PVT and you're like, I have no idea, you can always refer them to the PVT state helpline. And again, it's that 877 number. And with the PVT helpline, they can help request a replacement card if they lost it for some reason. They can request a new card to set their PIN number up, report an address change if they feel they didn't receive it because they moved previously and they changed their address too late. They can also help with eligibility or benefit amount questions. And again, they can also help in other languages other than English and Spanish. And just a quick overview on how to get a live person at the state helpline. They'll have to call that 877 number, pick their language, have the 16-digit card number. If they don't have that, they don't need to do anything. They just stay on the line. They can press 5 if calling about PVT. For general info, it'll be number 1. For number 2 is to set up their PIN. For 3 is the address change. 4, if they're not calling about PVT. And then again, they can stay on the line if they would like to speak to a person about PVT. So any issues that you have about PVT or CalFresh, if things are not being resolved or you're unsure how to answer a question, or you're seeing a type of trend in types of issues, you can reach out to me. There's my email in there, or I'm sure you can also put it in the Slack channel and I'll be able to answer that as well. So no worries there. Any questions about PVT? I know it was a lot. All right.
Okay, so that's basically the end of the training. If you can put your name in the chat box real quick, if you're interested in still doing the call center, that way I can email you all the follow-up and the forms you'll need. And I believe we'll have the forms in the Gmail account as well.